Quinn, how are you?
Good, how are you?
Good, nice to meet you. Stand this way.
Well, thank you very much for being here today with us.
Well, thank you. Thanks for taking the time to come in.
You're a parent. Have your kids ever been to the Janeway?
They certainly have. Not only am I a parent, my wife works in the Janeway Emergency Department. So we have had the fortune of having her work there, but have had the experience of bringing my children to the Janeway Emergency Department on more than one occasion. I have one in particular who's pretty injury prone, and I'm not going to name names, but he has been in the Janeway Emergency Department a couple of times now.
In your experience, what's different about children's health care?
Well, children's health care is so important, and it's very different than adult health care. You're not only treating the patient and the individual, you're really treating the entire family and the support network that goes with that. It's complicated in that everybody is so vested in the care of the patient. Not that they aren't for adults, but the degree of attention and the degree of emotional investment that you put in as a provider, nurse, paramedic, physician, is just extraordinary when it comes to children's care. And I've been very fortunate to work in the Janeway on multiple occasions and for multiple years. And we have some of the best professionals caring for the children across our province in that institution. It is just incredible. I've worked across the world. They are by far the best.
I'm a pretty frequent user of the healthcare system, and I was very interested, as you said, to learn that our premier is a surgeon. So you know how important it is to make kids better and make them better quickly. So what are some of the things that the government has been doing to improve our healthcare?
So we recognize right now, coming out of COVID-19 in particular, that there's incredible stress and strain on the healthcare system, not just for children, but for everybody who uses and touches our healthcare system. And part of the reason for that is the pandemic, but there are numerous reasons that existed before the pandemic that have been accelerated and really highlighted now as we emerge from the pandemic. And a large part of that is a result of the fact that we have a healthcare system that really hasn't evolved substantially since we designed universal healthcare in the 1960s. And society has changed, technology has changed, the way we live in Newfoundland and Labrador has changed, the industries here have changed. And so we need to be looking at how to change the healthcare system, to transform it, to make sure that it's there for everybody. The government takes its investment in healthcare very seriously. For example, this year, our government is investing the most money ever in the healthcare system across Newfoundland and Labrador. So it's a historic and generational investment, not just in the operations, but in the transformation of the healthcare system. But primarily and principally, the investments that government make is towards operations and towards infrastructure, towards human resources, to make sure that the lights are on, that there's supplies in place, that there's doctors and nurses. And we recognize there are challenges, but that's why we're investing so much money to try to overcome those challenges. Where the people at home often come into the equation is in helping the Janeway, for example, invest in new technologies, because there will always be gaps. One of the brilliant things and one of the most exciting parts of practicing medicine is that what's normal today will not be normal tomorrow. And it's whether that's from changing science, changing evidence, or changing technology. So I know in my career, for example, I've treated patients, miracle children who, for example, there was a piece of new technology required for limb reconstruction. They availed of some resources provided from people at home to help us get that technology to help reconstruct a limb. And that's just one example. That goes across, of course, all the disciplines and all the care that is being provided in the Janeway. So as much as government can be there will always be small gaps and sometimes bigger gaps as technology changes and the cost of delivering medicine increases with those technological advances. And that's where people at home have been so generous. They've been so kind in opening up their hearts and their wallets to meet the demands, especially at the Janeway.
That makes sense, and it's one of the biggest challenges, so it takes a big group to make it better.
Absolutely. I mean, when you think of the organism that is a hospital, it's not just a surgical suite. It's not just an emergency department. It's all the volunteers working inside. It's all the people working inside. It's a collection of people. It's a collection of instruments. It's a collection of doctors and nurses and paramedics and support staff who are all there for one purpose: to care for the people in the community. So the building is important. The technology is important, but most important is the people in those walls using their technology. They don't go to work. They only go to work with one common purpose, and that's to care for an individual patient or series of individual patients that day, because they know that when they go home from work, someone's life will be a little bit better. And that is a spirit that we need to recognize. It's a spirit that we need to invest in, and it's a really special thing about being part of that system and being part of it specifically in Newfoundland and Labrador, because Newfoundlanders and Labradorians, I think what sets us apart from other Canadians is our unique sense of community and unique sense of place and belonging to place.
I couldn't have said it better myself.
Thanks for taking the time to come in, and I wish everybody working at the Janeway and everyone involved in the telethon the best of luck. Donating is your superpower.